last TATT chat of the month. It's hard to believe that we're more than halfway through the month, and I think we do have a timely topic. I think we all have, over the last 12 months almost, running on a year, what's grabbed us is COVID-19 and the virus, and everything's going out, and so it's a timely meeting. The good thing about Zooms is that you don't really lose your breath as you're running into the meeting breathless. You just have to connect the technology and get there. And so I see we've probably added 15, 20 people over the last minute. And so I'll go ahead and get into the minute because we want to just keep you an hour. And I'm going to get Dean, our executive director, to introduce our guest speaker. Dean.
Great, thank you, Terrence. And again, a good afternoon and Happy New Year for those who I have not had a chance to communicate with so far this year. It is hard to believe we are in the second half of January. As Terrence said, our goal for these sessions is to always have timely topics, and I think there is no question that our topic for today is one of the big topics going on right now, the virus, and the immunization element is so critical. And I am fortunate to be on the Environmental Justice Committee of DHEC, and we had a committee meeting, I guess in mid or late December, and I was introduced through that to Dr. Knoche, who gave a presentation that day to our group, and I felt like he would be a perfect person to invite to be part of one of our TATT chats, because he is right on the firing lines of what's going on around the South Carolina response to the COVID vaccine. So with that, I will turn it over to Dr. Knoche, and he is going to give some remarks and updates, and then we'll have the availability for questions. So if you would like to put any questions into the chat, we will facilitate those once he is done with his remarks. But Dr. Knoche, I will turn it over to you.
Thanks, Dean. Good to see you again. It is hard to believe that it's been a couple of months since we last had that meeting, the Environmental Justice Group. But time flies in these crazy times. So happy to share with you all a bit of an update about where things are in South Carolina as far as our numbers go and vaccine efforts, and what things look like a little bit more specifically in the upstate as well. And like Dean said, I'm very happy to answer any questions that y'all might have. So let's see if I can get this to work. All right, so the information I'm going to share with you is the information that I had as of yesterday. New updated information is on our website, updated daily, so this might be a day old, but I put these slides together yesterday. So I just want to go over again some of the numbers, the epidemiology of the cases in South Carolina and where we've been and what things look like. One second, I just need to minimize my screen here. There we go. Okay. So we've had 400,000 cases of COVID-19 in South Carolina and over 6,000 deaths. That number is very high for the number of deaths. Just to put it into a little bit of context for you, in a year, our last flu season, we had about 140 flu deaths. So people talk about COVID being like a bad case of the flu. And it might feel like it, but it's been far more deadly than any flu or respiratory infection, more deadly than homicides, suicides, car accidents. In a calendar year, we get about 10,000 deaths from heart attacks or heart disease, and 10,000 deaths from all cancers combined. So, COVID-19 was the third leading cause of death in 2020. So just to put into a little bit of perspective for you, when you hear the number, what does that actually mean? It's substantial. It's a pretty significant cause of death that we're taking seriously and doing our best to try and prevent it. So this shows the trend over time. And I remember when we had our peak in the summer, and I think that was a time that gave us pause for concern, because the thought was COVID-19 is caused by coronavirus, and coronaviruses generally do a little bit better in the summer months. So I think when we saw cases going up in the summer, I think that gave people pause, thinking ahead, looking ahead to what the summer might hold. And obviously it's been unfortunate, not just in South Carolina, but across the country, a pretty dark winter as far as COVID-19 goes. It's been fueled, I would say, in large part by, holidays, travel, people gathering indoors as the weather, gets cold. So you can see here that the green line is the 7-day moving average. So we, our bigger peak was earlier in the month. So it's still very high, but it looks like there may be a downward trend. There were some issues with numbers getting reported to the state. So I'm not, 100% confident that this is representing a true downward trajectory. So we'll have to see as we had some reporting issues get sorted out, what happens thereafter. This graph breaks down the cases by region. So you can see the upstate region there in the dark blue is the highest, looking at the 7-day moving average. So, everybody had their peak earlier in January, but the upstate was most negatively impacted compared to the other 4 regions around the state. And that was, the case earlier in the pandemic. So the Greenville and Spartanburg region in particular have seen quite a jump. So I'm going to just kind of tease it out a little bit for you. One of the things that people say, let me go back one second. So this is the number of cases, and people say, well, that's the number of cases. You could have more cases or less cases depending on how much you test, which is true. So the more people you test, the more cases you will find, presumably. So one way that we help normalize it is to look at the percent positive out there. So it normalizes the trend based on the percent that are positive, kind of takes that factor out. So you can still see that even though the cases were going up, the percent of people who were positive was also going up very substantially across the state. So in the summertime, we were around 20%, which is very significant community transmission, compared to around 5% that we saw at the end of May. And then in winter and January, we really saw numbers go up above 30% across the state. Now, if I zoom in, I can do this, and this information that I'm showing you is available on our website as well. So this isn't proprietary information. You can go find this on our website as well. But if I zoom in a little bit here, go back there, and pull out the Greenville on the top and Spartanburg on the bottom, you can see that their percent positivity rates went up over 40%. Again, that reflects the higher numbers we were seeing in the upstate region and in that area as well. So pretty substantial increase in community spread in Spartanburg County and Greenville counties. I just put this on here as a comparison in the Midlands and the Low Country, just to represent 2 other large counties that have university populations and some young person populations as well. You can see the top Richland, they got to around 30% positivity, as did Charleston County. So everybody had an uptick, but Greenville and Spartanburg had a higher number and a higher percent were positive. So this goes now transitioning from the number of cases. This is looking at the number of deaths, and this is by week. So again, we've had over 6,000 deaths reported in South Carolina. Our peaks we've had 2 peaks, one in the summer and one now in the winter. And this is looking at all deaths across the state. You can see the disproportionate impact on the elderly population. The average age of death is 75 years of age, and about 2/3 of those cases happen in people over the age of 70. So that's also part of our vaccine initiative, is trying to reduce mortality. So that's why we're seeing not just frontline healthcare workers getting the vaccine, but also people who are over the age of 70. And this again is on our website, but this is looking at deaths by county. And so the darker the county, the higher the number of deaths. And Greenville and Spartanburg County, you can see 631 is represented and is the darkest, is the highest number of deaths. And I think the other Spartanburg, I want to say, was 434 deaths when I looked at it yesterday. And so those 2 counties combined represent almost 20% of all the deaths in South Carolina. I think it was 18% when I calculated it yesterday. So a very substantial burden, both by number of cases and number of deaths, are falling in Greenville and Spartanburg counties. And this is looking at the deaths in Greenville County over time, and on a weekly basis. So again, you can see the spike in the summer months, and then in the winter months now you see also a large spike for the number of deaths, and you can see that the breakdown of the population there on the bottom. Again, a very substantial number of deaths in people who are over the age of 70. So over 70% of the deaths there. And this is Spartanburg County. So again, also increased curve or increased spike rate in the winter months, more deaths occurring, and also around 70% of the deaths occurring in people over the age of 70 in Spartanburg County. So I just want to talk briefly about vaccines and the vaccine initiative and what's kind of been going on around the state. There are a lot of moving parts with DHEC working on some things, the federal government having some partnerships with pharmacies that happen alongside of DHEC, but also separate from DHEC that we don't have full control over. But there's a lot of moving parts, and it feels like we're building the airplane as we're trying to fly it, to be honest. So the two vaccines that are currently out on the market are both mRNA-based vaccines. This is a new kind of vaccine. The two companies that have come out that have been approved from the FDA have been the Moderna vaccine and the Pfizer-BioNTech vaccine. And the way that these vaccines work is essentially the vaccine delivers part of the genetic code from the coronavirus that codes for the protein on the surface of the coronavirus. And that protein, that spike protein on the surface, normally allows the virus to get into the human cell and spread and replicate. So essentially what this vaccine is doing is saying, okay, we're going to give you the genetic code to make just the spike protein, just the thing on the outside of the coronavirus, and your body is going to make this protein. But when it sees that protein, it's going to say, hey, wait a minute, this isn't, Dr. Knoche, this isn't his own body, this is something foreign, and make antibodies and attack it. So then when the actual virus shows up, it's going to say, hey, there's that spike protein again. Antibodies jump in and start the immune response. So both the Moderna and the Pfizer vaccine in their trials reported 95% efficacy after getting 2 doses of the vaccine. And those doses are spaced either 3 weeks apart or 4 weeks apart. And a 95% efficacy is excellent. I mean, it's just a phenomenal efficacy rate, and it's astounding how quickly this was able to roll out and how much collaboration happened from when the genetic sequence was first shared with the public back in January of 2020. So the approval first happened for these vaccines was at the beginning of December, essentially, and shortly thereafter, they rolled out a week apart. The first vaccines that we got were the Pfizer vaccine for people working in a healthcare setting, so people that work in the hospital or an outpatient setting. And then the Moderna vaccine was given in a federal contract to CVS and Walgreens to vaccinate long-term care facility residents and their staff. So people in nursing homes, long-term care facilities, skilled nursing facilities, places like that. And as we received more vaccine, we lowered the original recommendation was 75 and older, and we were able to lower it to 70 and older. And so that started about a week and a half ago, it was about a week ago that change happened, and people are making appointments across the state. So far, again, this is yesterday, so this is probably updated on our website now, but this is looking just at the Pfizer vaccine. So 75% roughly of the vaccine that we had received had been given, and the remaining 25% essentially people already had appointments for to get the vaccine. So it's a high utilization rate. There's definitely much more demand than there is supply. We get thousands of phone calls every single day. When it was first announced that we were going to be opening up vaccination for people who are 70 and older, our phone system broke. I think people, they could call DHEC to get phone numbers of other places they could call to make an appointment. I don't know if people thought that they needed to make the appointment with DHEC or what, but it essentially broke our system as thousands and thousands of people were calling in. So definitely high demand, and our supply is not high enough to meet that demand right now. And this is again the information from Moderna vaccine that's currently going to long-term care facilities and nursing homes. This is information that's on our website. Let me just see if I can pull this up for you. So this is information that is updated daily, and I believe when I went on yesterday or the day before, it's showing that Publix had come online, as well as here's Teeter location. So if somebody goes to the website, this is what they'll find. The green represents areas that are accepting appointments. So you can see there is a very significant amount of options in the upstate region. I'll just click on this one as an example. Prisma Health Lawrence. Here's one over in Anderson. Ingalls Pharmacy. So if you click on the arrow, it should give you more information. Here's a location, here's our website. And then presumably if I go to their website, I'd be able to find their contact information. But the idea is that people would be able to then call and make their appointment for whenever the appointments are available. I do know that there have been some issues, again, with supply, and people's appointments have had to be changed because of supply issues. So these, again, are the places people can go, and I'll have this website listed at the end of my presentation for your reference. Let me go back to my, my presentation here. Okay. All right. Oops. Oops, 1 second. Okay. And we've also put out a call for people that may be able to assist and volunteer their time to provide vaccination to do that as well. I know some of the private health systems have their own system to volunteer. I personally live down in the Charleston area, so I know MUSC has a system like that. But DHEC also has a website available for medical professionals to volunteer their time and their services to help in the vaccination efforts. Because once vaccine supplies roll in and we want to get this done as quickly as possible, we'll need all hands we can get on deck. So this is the information, again, that I wanted to share. The first website is just the general COVID-19 website. The map that I showed, that interactive map where you can click on locations that are giving vaccine, if you just type in scdhec.gov/vax-locator, that'll take you right to that page. So scdhec.gov/vax-locator. And then I know there's some business folks here on this presentation, so I just wanted to also provide this business guidance website. I think some of you may have seen it before as well. Let me see if I can just pull it up here again one more time on the website. So some of you might have seen this business and employer guide. I think one of the more helpful documents that I've referenced a number of times when we get phone calls from people in business is this interim guidance for COVID-19 scenarios for business. So it kind of just walks through if there's an employee who tests positive, what you should do. If there's an employee who's a contact of a case, what you should do if they're sick but didn't have a test done. Thinking here contacts of contacts. And so it just gives different examples of kind of what to do and how to handle different situations that might come up in business. So hopefully that might be of some use to folks here as well. And I believe that was my last slide. I wanted to give more opportunity for people to ask questions. I know the chat box, I see it flashing. I haven't looked at it, but wanted to be able to answer questions and have more interaction. So
Great.
There.
I will take care of that, Dr. Knoche. And just so you know, your sound has gone in and out a couple times, so I want to make sure that everyone can hear you. I'm going to start with the first question that we received, which is if someone has had COVID-19, what is the guidance for them in terms of getting the vaccine? Is there a waiting period after you've had the virus? How should someone approach it if they have had COVID-19?
Good question. So both for people who've had the virus or have had antibody therapy, we're recommending that they wait 90 days from their infection, because we think that passive immunity from antibodies or active immunity from having the infection protects you for at least 90 days. We want to try and vaccinate people who are still at risk. So we're asking and recommending that people wait 90 days from when they were infected or had antibody therapy before they get the vaccine at this time.
The next question relates specifically to the slide you had about the death counts. Is this, I think, and Walker, if I'm not right, please unmute yourself to ask the question, but I think she's asking, is that those that are presumed to be specifically because of COVID-19, or is it that where it's one of the factors, or how does that work to know if the death is specifically to COVID or in general?
So deaths are reported. I mean, a death certificate, essentially the causes of death are listed on the death certificate by the physician who is caring for that person, and that's up to their medical judgment to determine. And so there could be a few different places on the death certificate where they might say what the cause of death was, or a contributing factor of death, or conditions that were a contribution to that cause of death. So you might, I guess the analogy might be, somebody might have diabetes. No, that's a bad example. I'm trying to think of a good example. Essentially, it's either a confirmed case or a probable case that I included in those numbers. Those can get separated out, and we do have that on our website, but those numbers are combined, confirmed, and probable cases.
Thank you. I meant probable.
That's based on having a positive PCR. The confirmed one is if you have a positive PCR test. So if they had a confirmatory test, then that's a death.
So the next question we have is, there have been news reports that South Carolina has received, and it says here only 20 to 25% of the vaccine doses promised. Is that correct? And what is the overview of the number of vaccines were received? You said obviously there's more demand than there is vaccines. Are we getting the portion of the overall that's been produced that our state is supposed to be getting, I guess, is the question.
Yeah, that's a great question. So there were some reports, I haven't looked at all of them, but I heard discussion here at DHEC with some people saying, oh, DHEC, South Carolina had one of the lowest numbers in the country of vaccines that were given out to its per population size. But if you look at the amount of vaccine that was allocated, we also had a lower number of vaccine allocated, one of the lowest numbers of vaccine allocated for population size. So, looking at the percent supply that we have has been given, it was 75% of what we have went out the door, and the rest of it's scheduled. And so our leadership in South Carolina was, reviewing the information, looking and talking with the CDC and Operation Warp Speed, and looking at the allocation and trying to figure out how it compared to other states across the country. And some of that had to do with, again, as I alluded to at the beginning, the way that doses were assigned. We did it differently in South Carolina than other states as far as long-term care facility programs. So unlike other states, South Carolina immediately allocated to the long-term care facility program the entire amount of doses that were needed to ensure that every long-term care facility resident and staff member in the state had both doses of vaccine available to them. So some of the other states instead chose to allocate doses to their long-term care facility program on an as-needed basis. So those states are having to had more doses shipped to them into their state, but those states are going to have to continue to send their doses to the long-term care facility program pharmacies over the next several weeks, which is going to decrease their number of vaccine available for their state. So that's a little bit complicated. It's probably getting into weeds more than people really want or need to know, but that's something that we looked at because we saw this report on some of these websites and people looking at it and saying what's going on, and we reviewed it, and we're getting our fair distribution. We feel it's fair and appropriate, and so I hope that answers that question.
Yes, absolutely. The next question is coming from Franny in Cherokee County, and it refers to the map that you showed about the locations where vaccines are available. And she said that that is not necessarily accurate, that some of the locations in Cherokee specifically are not actually administering those. And Franny, if I'm not saying that right, please unmute yourself. But how do you guys, I'm sure there's some variances in terms of getting a location up to speed to be able to do the vaccines. Is that part of maybe that lag time where the maps might be showing it a little bit differently?
Yeah, so it's definitely taking a significant amount of effort, not just for DHEC, but really calling on the other healthcare systems and other providers across the state to undertake this Herculean effort. And I'll say that for, I saw the slides at the beginning where you had Furman listed and Clemson and Prisma. And, we have a call with that group of people every Wednesday looking at how we can work together to identify places that need to get the vaccine. They're talking about rolling out mobile vans and setting up mobile sites to go and vaccinate where we need to have, vaccine delivered and administered. We know that there are 8 counties across the state that don't have a hospital in their county, in their backyard. So we recognize that it's not easy for, a healthcare provider or people in the community to easily go to one of those places. So that's, been a target for us as well, and an issue for us as well, making sure that partnering with providers that might, still be in the area, federally qualified health centers, our own DHEC teams, where do we need to have mobile sites and pop-up sites? And I think as we move into the next phases, we'll push those efforts out more. Right now we're still in phase 1A, and there's a lot of people to be vaccinated in those groups. But as we move into 1B and 1C, you're talking about adding, 500,000 people and then 3 million people. I mean, by the time you get to phase 1C, you're talking about 3 million South Carolinians. So that's a lot of people. So definitely we're going to need those sites and those options when we get there. And I think right now all those partners and pieces are coming together.
Great. Is there any data on the longevity of the effectiveness of the vaccine? And I'll add to that, is there a difference between the two, the Moderna and the Pfizer at this point? So in other words, is this something that, like the flu vaccine, will probably have to be done annually, or what is that looking like? Or do you even know yet at this point?
As far as needing a booster dose, we don't know yet. I think so far the follow-up studies that have been done looking at folks post-vaccination who are in the studies are positive. They're very encouraging. Between the two, they're essentially equivalent. They're both 94 and 95% effective. Really the only difference is just storage requirements. The Pfizer vaccine just needs to be stored in very, very ultra cold temperatures, needs dry ice. It has some more requirements than the Moderna vaccine as far as storage goes, but they're equivalent as far as their efficacy goes. I would feel comfortable myself getting either one.
Great. This next question is a specific question, but I think it can illustrate kind of how the system works around getting the vaccine. From Sean says, I signed my elderly neighbor up with Spartanburg Regional Health System wait list and the Ingalls wait list. Will Spartan Regional contact her when an appointment becomes available? So how does that kind of work? If someone's on a wait list, who lets them know, and when does that happen?
Yeah, I can't really speak for those individual instances. I don't know how individual
Sure.
providers or health systems are handling that, their wait list and notification. I guess I would have to refer them back to the place where they signed up to find out the answer to that question. I don't know.
Okay, so that's all being done at the local level, not necessarily once you guys get the vaccines to the local distributors, then they are responsible specifically for getting them out to the folks in that community.
Correct. That's correct.
Okay. How do companies register their employees and for the vaccine? And then is there information on the call center that is under development?
So that's a good question. There have been, I don't know all the operational logistical decisions that are going to make this happen, because there are different sort of sectors within DHEC that are working on rolling out the plan and operationalizing it. And I know that there were different discussions about potentially having some clinics that happen on job sites, sort of like employee health, but you know, we recognize that there are some places that don't have an employee health center, versus needing to show proof with a badge or some other documentation to say that they're considered one of the frontline essential workers. So the final plan and how that's going to happen, I can't speak to. These are just some of the discussions that have happened. I did have a call, as an example, I had a call earlier this morning with a pediatrician because we added to the list yesterday after the vaccine advisory committee that parents who are providing necessary medical care in their home for their children who have severe medical conditions and are their primary healthcare provider essentially in their home, that they can also get the vaccine. And that essentially they need to provide some documentation from their primary care provider that attests to that. So one of the pediatricians called me and had some questions about that. So in that case, they were relying on a letter from a pediatrician. So it might be that people have to come with, a letter from their employer saying, I work for X, Y, and Z, and that they would fit within the appropriate category. But these are all options. I don't know exactly. It'll probably be a combination of some of these different options.
Okay, great. The next question comes from Mayor McClear in Fountain Inn. And Danielle, I know you're on, and I'm not sure if anybody from any of our other federal delegations are on, right now, but the question is there anything that can be done at the federal level regarding to expediting the rollout? I mean, and Dr. Knoche, I will kind of ask you first before Danielle, if you want to provide anything there. Is there a sense that, I mean, what I'm hearing is as soon as the vaccines are getting produced, they're being shipped out across the country. Do you feel that's accurate, or do you think that there is a lag happening between when the vaccines are being produced and when they are getting to South Carolina and to the other states?
Its rollout has been going along pretty well, I would say, on the whole. To your question about what the federal government can do, I don't have any specific insider information about that, but what I read in the news today was about President Biden signing orders calling on FEMA and the National Guard to be mobilized to help with vaccine rollout and setting up mobile sites. So there's over, I think between the two, over 40,000 personnel, and they want to set up 100, sites or something like that. I don't know exactly the details across the country. I also read in the news that the chief executive of Amazon has also wrote to the president and offered Amazon's logistics support if they needed help, transporting vaccine, if they needed that additional support, that they were ready and willing to help the government work on that. So those are things I just read in the news. I don't have any further information about those things myself beyond what I read, but I'm hopeful that some of these changes in administration and are going to kind of inject a new level of energy to get some of this done.
Danielle or Jordan, do you or Freddie, do you guys have any updates from our congressman or senator? Danielle?
We have called pretty regularly with both DHEC and the governor's office, just increasing bandwidth and other things, since it has been so hard to get through for folks who are trying to schedule. So we have calls with them multiple times a week. In terms of at the federal level, I think with a lot of the changes in the committee staff and the transfer of power up there right now, I don't have a whole lot new for you at that level, but I do think as much has been pushed down at this point to DHEC and the governor's offices across the country, we're staying in pretty constant contact there because we're answering those questions all day long, honestly.
Great. Freddie or Jordan, anything to add? Freddie?
Really no more. Congressman Timmons was on a call this week with the governor and his chief of staff as far as any kind of assistance they could give. What we're understanding too is more or less like what you said. We're waiting on the rollout as far as the numbers that are coming. I think they're coming as fast as they can. But our office is like Senator Scott's office, trying to help as far as getting the people. Sometimes we have some older people and people that don't have internet access, get them logged into the system the best we can. Yes, sir.
Great. Jordan, anything from Congressman Duncan's office? I thought you were unmuted. So Jordan, anything to add? All right. Well, we'll go on for a couple.
Can I just add one last thing here, Dean? Because I just opened up the chat box. I saw there was a couple of questions about what phase people fall in. So
yes, I had some more questions. I was just moving on from that subject, but yes, go ahead.
Oh, okay. Sorry. Okay. Sorry about that. So all the information about what phase we're in and who's in what phase gets updated. Again, like I said, parents of kids who are medically fragile and need care at home was added to this just yesterday. So if you want to know what phase we're in and who's in it, if you go to the DHEC website, there's a button to go to the, I'll just go back to the main COVID page. So this is the main landing page for COVID. And if you go to the vaccine information, it's the first tab there on the links, you'll get to this and I'll go through phase 1A and who falls in 1A. There's a list there that kind of answers that question. Again, this is the parents that were just added yesterday. And then I think there's a question about teachers and other conditions. Teachers are in 1B. So it's listed here, people in the educational sector. And there's an estimated population there. As you can see, we're talking about 600,000 people here, about 1 million people in 1A. And then 1C is a very big proportion of the South Carolina population, people 65 and older, people 60 and older with underlying conditions, and other essential workers. So that's 3 million people before we even get into phase 2 of the vaccine. So, we're talking about 1 million people in the first 1A. And if I go to this link here, COVID vaccine allocation South Carolina, that'll take you to the numbers. So again, this was updated from yesterday. So I think on my slides, I think I had 74%. So we got some more doses were delivered yesterday. So now it makes our utilization number go down. So instead of 74%, we're now at 59%. So you can see total doses received in South Carolina is 424,000 roughly. So, again, this is all public facing, this is public information. There's not, if people want to know what's out there, what's available, what we're estimating for the population size we need to serve, it's all on our website. It sometimes takes a little bit of effort to find it, but it's all there. If people want to kind of do a little bit of the digging and see what they can find, it's there. So I just wanted to share that as well.
Great, thank you. And Jordan, you guys probably saw her comment that she dittoed basically what Danielle and Freddie said, and that like everyone else, I want to commend you, Dr. Knoche. I think you guys are doing a great job of, as soon as the vaccines gain, they're obviously getting them out, and certainly there's always individual concerns and people who have stories of problems, but that doesn't mean that it's not being done very well and there's not great things happening. So I want to commend and thank you on that. The last question I see here from John Miller is, and this gets back to you kind of said about the different levels, but people with cancer, are they moving up on that priority? How does that work? I think you got to unmute again.
Sorry, can you hear me now? Am I okay?
Yeah.
Okay, sorry about that. Right now, we don't go into specifics about what kind of cancer you might have or what stage it might be in, or if you're in remission, or if you have other autoimmune conditions or conditions that put you at higher risk. We would leave that more. I mean, there is a list from the CDC. There's a very specific list, but let me see if I can pull it up for you here. I think that those people are in 1C currently. And again, my first slide was on that these things change, right? So before we started, 1A didn't have people who were 70 and older, and it didn't have parents who took care of kids that needed care at home. So some of these things change. So when I pull this up, hang on one second, if I can share my screen one more time. There we go. So phase 1C, people 16 and older with underlying conditions that put them at highest risk. And there's a list by the CDC. So if you click on that, it'll pull up this site from the CDC, people with certain medical conditions, and it goes through people at increased risk: cancer, COPD, Down syndrome, sickle cell, type 2 diabetes, people who might be at increased risk, and it lists some others there. So I would say people that definitely fall in this upper category would be included. Might there be some others that aren't listed in these, I don't know, 10 or 12, how many are here, that would put them at high risk? Sure. And that would be, you know, up to the vaccinating provider to help sort that out. I mean, we don't want to be an institution that says no to people that qualify. So that's why, you know, we give latitude to providers to help, you know, make some of these determinations as well. So for right now, the cancer group is falling into 1C. Could that change? Perhaps. Depends, you know, how things unfold here in the coming weeks.
Great, thank you. Well, again, Dr. Knoche, I appreciate you very much taking the time. Just so everybody knows, his slides we will have on in the update that we'll send out tomorrow, and we will also make sure the links to the DHEC website are included as well. So Dr. Knoche, thank you again so much for taking the time to be with us, and again for all the great work that you and others at DHEC and across the state are doing.
Well, thanks for having me. I appreciate the opportunity. I'll send the slides over to you straight away.
Great, thank you.
Sure.
And before we go, I did want to acknowledge, just so everybody we're on the same page, I know Angie from Senator Graham's office is on as well. So I didn't want people to think that one of our legislators is not caring about this issue. So Angie, thank you. Is there anything that you had to add to what Freddie and Danielle said earlier, and Jordan?
Hey, Dean, thank you so much. Nothing currently to add from what they've already said. Really the same thing. Senator Graham, along with all the other congressional members, have been talking to DHEC along with the governor's office. And exactly what Jordan said, from what we understand in the calls we've had this week, they're being delivered as quickly as they're being produced. So they're getting sent out as soon as they get produced. But if we have any additional information to add later, we can definitely let you all know.
Great, thank you. And you know, and I just want to say I appreciate the great partnership we have with all of our legislative offices and all the great work you're doing. And of course, when they send us information to reach out to our partners and others, we you know, are happy to be a conduit for that. So with that, I have a couple quick updates now. I'm gonna give Michael Hildebrand a minute before we move on to a couple county updates. We have a lot of events and things moving on. I don't know if you guys have seen our e-blast that went out today with our year in review from 2020, but Erica will put that link in the chat if anyone wants to check out our year in review from 2020. And again, thanks to all our partners who helped allow us at 10 at the Top to be able to focus on our efforts instead of fundraising. You guys have been great partners this year, and I couldn't thank you enough for all of the continued support. Next week, we have our sneak peek event for young professionals talking about social networking. So that is happening next week. For if you want to make sure the young professionals in your office are engaged there as we move forward with that initiative, and Erica will put that in the link. And then on February 3rd, we have Earl Gregorich from our partners at the Small Business Development Center, and then also a representative from Senator Scott's office who focuses on the PPP to talk about the rollout of PPP2. And Aaron, you're on here. Is there anything else to add to that?
No, Dean, but I think it's a real honor that we are having a true expert come and speak to us. He helped write he was involved in evaluating and writing some of the legislation. So we're really pleased to have him. And Danielle, thank you for connecting us.
Great. So that is on February 3rd. So the link is here for that for anyone who is interested there. And then Michael, you've got some great things coming up. If you want to share for a minute about the work of the Mobility Alliance and your new program.
Sure, thanks, Dean. So this year we'll be kicking off a quarterly series focused on the connection between transportation and community vibrancy. So on February the 23rd, we will have the city managers from the Golden Strip, which is Malden, Simpsonville, and Fountain Inn, as well as the county administrator for Lawrence County on to discuss how do they see their communities growing in the next 20 years and what role transportation plays in that. Additionally, we'll continue the podcast series this year. Actually, tomorrow I'll be interviewing Jody Bryson with ITIC and talking about what really makes ITIC unique and innovative for the upstate and for South Carolina overall. So I'll be sending those out within the next couple of days, so stay tuned.
Great, and we will have the links for those in our upcoming chats as well. So with that, Justine, I'll turn it over to you to introduce our county updates.
All righty, thank you. We have first up Latokia Trigg from Ready SC. She's in several different counties, Spartanburg, Cherokee, Union. So she's going to talk to us for a couple minutes about their work and employment statuses.
Good afternoon. Can you all hear me?
Yes.
Okay. Again, Latokia Trigg. I'm with Ready SC. I am the representative area director for the Spartanburg Community College service area. So I have Spartanburg, Cherokee, and Union counties. Ready SC specifically is part of the South Carolina Technical College system that assists new and expanding industry with recruitment and training. And so we currently, for our 3 service areas, have projects right now in both Spartanburg County open and Cherokee County, a couple of Cherokee County projects. Throughout COVID, our office is back, my staff is back, and we are assisting our companies. Of course, all of our projects, they have adjusted to COVID like we all have had to do. And the one that I have in Spartanburg County currently recruiting is AirSys cooling technologies. And so we do currently have one posting up on sctechjobs.com for AirSys cooling technologies for some assembly folks. But I think what we have done in our office is make sure that we're following the CDC guidelines in terms of training. And so we have continued to provide training. Spartanburg Community College is also open, providing classes right now too. So we've all adjusted, and we kind of take the lead of our client. So we have been doing in-person training. So we had classes going on today for particular projects, and we have do have some online modules and that sort of thing that we've developed in the case that a company might need that. So recruitment wise, we do see more postings come available. So you can always look at statewide postings that are Ready SC projects on sctechjobs.com.
Thank you so much. I put the link in the chat. So thanks very much for coming on with us. Dean?
Great, thank you. And I just want to say, Latokia, I want to know who your photographer is, because those pictures in your background are gorgeous.
Thank you, that was me.
Wow, well, you're hired.
I was thinking the same thing.
Thank you.
That is great. Those are beautiful. So it is my pleasure to introduce one of the newer folks to this upstate. She's someone who is familiar to the upstate in general, or in upstate, I should say, coming here from upstate New York. but I had the great pleasure a couple of weeks ago of meeting Barbara Ann Hegan, the new president and CEO of the Greenwood Area Chamber of Commerce. And Barbara Ann is already hitting the ground running. She's getting connected to folks around small business and entrepreneurship here in the upstate. And I know is going to make a great impact in Greenwood, a place that is already doing wonderful things. So Barbara Ann, it's my pleasure to again welcome you to this upstate, the warmer upstate, and to introduce you to the group and give you a chance to say hello.
Excellent. Thank you so much, Gina. And hello, everyone. I'm excited to be part of this group, and I can tell that it's a dynamic group that I will enjoy engaging with. I have a few updates here in Greenwood. Most recently, I started about 3 weeks ago, so I kicked off my listening tour and a survey of all of our businesses, whether they're members or not. We partnered with the city and the county to just get a gauge of how our businesses are doing post-COVID, or as we're trying to climb out of this pandemic. And we should have those results in by early next week. Another strong initiative that I'm excited to be a part of is the Economic Development Initiative happening here in Greenwood. It's called Greenwood Together, which is to advance economic and community development that will enhance the quality of life here in Greenwood County. So we are partnered with the industrial recruitment retention efforts, which is being led by our county government, along with Discover Greenwood from our tourism bureau and the Uptown Development Corporation. And all of us are going to be marketing our assets across all sectors and helping with the efforts of workforce development, education needs, which will be housed with the chamber, along with addressing housing, quality of life, retail and business recruitment and retention, both within the city limits and throughout the county. So we are very excited to support all of this, along with public transportation initiatives that we have underway with the county. So excited to dive into this, and I'm sure by our next meeting I'll have more details to report out. And thank you so much.
Great. Well, thank you, Barbara Ann. And it's again, glad to have you here in this upstate, and especially in Greenwood. And Justine, I'll turn it back over to you. Anything to finish up before we turn it over to Mayor Roberts?
Oh, here. Time to adjourn.
Good. Well, we're ahead of schedule here, Mayor, so I will turn it over to you to wrap up.
And I'm very good at adjourning meetings. That's a good meeting. It's an hour. We got a lot accomplished in an hour, heard a lot of good information. Again, thanks for everybody for what you do. And Dean's put up the link to the next chat. So please join us. Have a good weekend. Bye.
Bye.